if they're not, yeah, because I forgot this is on a completely separate account. So I would say you can just boot them because you're a host, and there won't be any. That's not going to mess with anything if they're boot off of that one.
Excellent. I will remove now then. Unless you want me to, I can wait a few more minutes, but.
I would say not. If it's not supposed to be a broadcast meeting, then it's neither here nor there.
Okay, well, I'm going to go ahead and remove them then if you want to let them know.
Yeah, I'll let them know right now.
Cool.
but
Recording in
I'll talk
progress.
about it anyway. So let me talk about one of the highlights we have in the Public Guardian's Office, and that is something we call Embrace the Senior. And Embrace the Senior, this year was our 6th year of doing this. This is a project that we specifically do designed to distribute holiday gifts to our seniors, to our cognitively impaired adults, our veterans, and our severely mentally ill PG clients. So our goal with Embrace the Senior is to provide a meaningful gift to our clients who maybe don't have family or are estranged from their family or financially unable to provide a gift. So we give them a little joy by giving them a gift. What's so great about this is it's all donations. So this year we had help from the Social Services Agency Engagement and Wellness Group. We incorporated a virtual giving campaign on Amazon and a virtual gift registry with signup.com. We put gift tags in lobbies, as you can see in our tree, with all kinds of gift tags on it. And here's the really great part. We had over 550 gifts donated, and it's gifts and monetary because the veterans offices, 2 of them, give quite a bit of monetary donations. We did raffles, 550 gifts, and we served 300 Public Guardian clients. So we're really very proud of this. It's Toys for Tots for adults. So, okay, let me talk about another highlight that we have in our office. Really wanted to highlight staff to the board today because staff has been so resilient through, as I'm sure you know, all of our staff in the county. But through COVID, one of the things that our staff do is we have to see clients, and we have to see clients in the community. So we've faced a lot of challenges this past year. And of course, with this vulnerable population being older adults, even harder to get into some of the facilities. So we did face some resistance, for some frustration and some fear from our staff. However, they still put the clients first, and they were in the community, and we came up with all sorts of solutions on how are we going to visit these clients. We had other impediments, like we had unvaccinated staff, not now, then, 2021. We had unvaccinated clients, unvaccinated folks in the facilities themselves. Some facilities had COVID outbreaks, which is what we're facing again right now, which makes community visits and visiting our clients a little tougher and have to be a little creative. So we did what we called window visits with staff on one side and the client on the other. We did porch visits. We used Androids and did Duo. We did FaceTime. We did Skype. We even lent facilities laptops so they could sit with our clients and we could do FaceTime that way. So the other hard part for the staff at Public Guardians was that we had every unit affected by someone with COVID. So we had a lot of clients who were COVID positive and quite a few clients in 2021 who passed away. In our public administrator side, we had staff not go into decedents' homes for 2 weeks because we weren't always sure if the person passed from COVID or not. So depending on what the referral said. So it was a tough year. However, I still want to go back to the staff's resilience. We had other things like 7 people leaving for VSIP, retirements, and we had some staff code deletions in the hybrid model. One of our biggest concerns this year was court delays. The court is delayed between 4 and 6 months. And so getting someone on a conservatorship took a long time. So I just want to say how resilient, again, staff were. They instantly adapted. They were flexible. They were patient. They were dedicated. And they found solutions and brought that to management. And I just can't say enough about, in this pandemic and all that we've gone through and all the challenges, I'm really proud to say how well the Public Administrative Guardian Office has done and commend people for just doing their best. And we're doing it. We're keeping people safe, and we're putting the ones who need to be on a conservatorship onto a conservatorship. Okay, one last highlight that I would just want to talk about is our communication has really improved this last year. So, we did a great job with improving and strengthening the communication with our internal partners and our external partners. We viewed the virtual meetings as an opportunity to improve and collaborate with partners more often because we didn't have to travel and go anywhere, and more timely. And it really has worked. So it's helped improve our services, brainstorm solutions and for processes and for client service. And just a few examples of the internal and external communication that's improved. Adult Protective Services and Public Guardians have a new MOU on referrals. We had one, but we revised it. It was over 6 years old. So that was fantastic. And I think part of that had to do with the virtual world, and we were able to figure out meetings. Another internal partner that's really improved is our partnership with financial management. And those are our folks that do accounts payable and accounts receivable and collect the fees for the clients who can afford it. And we do our clients' taxes. And so that's improved. And it's fantastic. There's so many more. There's county council, there's TSS. I want to talk about the community-based organizations. Specifically, I want to talk about real quick. We have started meeting with folks from Valley Med, some doctors and social workers, and really improved client services. So we've talked about a few of these clients who are difficult, these patients at Valley Med, and who, do they belong in a conservatorship? Do they not? Do they need someone to sign them into a facility? And really collaborated, and that's been really fantastic. And we're hoping actually to work together more on a split code, a split deputy code. Behavioral health, and especially Curtis at Barbara Aaron's Pavilion, we have monthly meetings with both of those folks, behavioral health and BAP, and have really tried to move clients along and talk about the difficulties and the placements, and that's worked out really well. So I want to commend public administrator guardian staff and all the folks that we continue to work with and provide services to. So yeah, that's our highlights. If there's any questions.
Thank you very much. I really appreciate your team and all the work that you've done. I'm first going to go to the public and see if we have any public speakers on this item.
There are no requests to speak.
Thank you. I'll come back to my colleague, Ms. Ellenberg. Did you have any comments or questions on this item?
I don't. Thank you very much for the report.
Thank you. And Lisa, I have a few. One is I wanted to better understand and learn a little bit more about AB 5270 and what's happening now in terms of your role. I know behavioral health is sort of leading an effort around stakeholder input, but I just wanted to better understand, Lisa, like your team and your team's role in that assembly bill. And if you wouldn't mind just for a moment explaining a little bit about it.
Sure. So our director is also here. So Marianne Warren is my supervisor and also part of this team that's collaborating on this 5270. So if Marianne wants to speak up at all, but let me just explain it. Oh, go ahead.
Oh, do you want me to? So sure. I don't know if you're familiar with the way conservatorship works right now, supervisors, but initially somebody's picked up on a 5150 psychiatric hold for 3 days. And then if so necessary, the hospital can petition the court for an additional 14-day hold on something called a 5250. And the 5270 is essentially adding another 30-day hold. So the facility can choose to treat the patient without having to pursue a conservatorship and still hold them for an additional 30 days. So it is a joint effort with behavioral health and the hospitals. And we are getting together next week to go through a presentation that we'll be doing for our community partners. There are some, particularly hospitals, who are very interested in pursuing this, and other patient advocate groups who feel more strongly that we shouldn't go forward with this because they don't want any sort of restrictions on personal liberties. So we are going to go have some public forums, get feedback, and hopefully come back to the full board in March to go forward with the request to start implementation.
And Marianne, is it optional for us? Like, could we opt out?
Yeah, we have to opt in. We're already out.
Oh, interesting. And could you talk just for a minute? I don't know if you heard the governor's announcement about investing more resources in conservatorship recently as part of his budget. I think it was a budget press conference he did. Do you know much about what they're looking at relative to conservatorships?
I don't offhand, but I do know part of it is appropriate placements because there just aren't enough throughout the state.
So when someone's conserved, finding the appropriate
Right.
to conserve them too.
First, the pathway is usually to go from the emergency protective setting to a long-term psychiatric facility and then step down to each lower level of care. And we're lacking across the board at all types of placements.
And I think if you could you just spend a little bit of time explaining to Susan and I how you get connected to somebody who is an EPS?
EPS has to make the referral. So in the public guardian side of things, anyone can make a referral, but on the public health, on the mental health conservatorships, the person must be being held on a psych hold. So they reach out to us if they think the person needs a conservatorship, and then we do our investigation and collaborate with the doctor.
So on that front, what's the number, if you know this, how many folks are referred to you for an evaluation from EPS?
Well, from all the hospitals, I have it, but not handy. Lisa, do you have that handy? Yeah, so if we're talking all conservatorship, all LPS conservatorships for this past year, it was about 323. But that's not all from EPS. They could be from a locked facility, jail, Good Sam, El Camino. They could be from Stanford. Of that 323, we only conserve about 25% of those permanent conservatorships. They'll go on a TCON and an alternate plan will be developed, or they no longer need it. So they're taken off a temporary conservatorship, but only 25% in LPS side, the severely mentally ill side, go on to a permanent.
I'm going to jump in here. It's a little bit of a misnomer too to call it. It is called a permanent conservatorship, but it's for 1 year. It's
right.
reviewed annually.
Right. So the conservator plays the role of working through and investigating whether or not the person needs to be kept on that psychiatric or in that conservator.
Right. In collaboration with the doctor, because the doctor has to say the person is still gravely disabled.
And when you all are doing these evaluations for people who are gravely disabled, what percentage of these folks are of that 323 are homeless at the time that you are engaged to get to know them and do the investigation?
None, because our client, when someone is referred, they have to be in an acute setting. So they have to be in a hospital, some kind of an acute setting. So they wouldn't be homeless for a psychiatrist to refer them.
What I mean is that many people that are in EPS are in fact homeless.
Oh.
So what I'm asking, and here's really what I'm trying to understand, is that I'm trying to understand why we have so many people that are, I know the definition of gravely disabled is something that is really worthy of a deeper dive into, but it's hard for me to understand how many people end up in EPS or that I see in the neighborhood I live in that appear to be gravely disabled because they're not clothed properly, they're maybe undernourished, they're perhaps it's pretty obvious that they have mental health issues. And what I'm wondering is from your division, do you all have the skill set, capacity, or is that within your purview today to address if somebody's gravely disabled?
I think the problem isn't so much gravely disabled. I think it's a dual diagnosis of gravely disabled due to drug and alcohol abuse. So we'll get people who are in psych emergency who have an alcohol problem and they're in the hospital not drinking, they sober up and can articulate a care plan and are discharged because they are no longer gravely disabled. So it becomes cyclical. But yeah, it does require a deeper dive. So
taking that subgroup away for a moment, again, you know, I recognize we are serving a lot of people through our systems, but what it appears to me from the outside, which is why I'm asking the question, that there's a significant disconnect between the work that you're doing and this very high need population. And my observation has been that we have a high level of expertise. Your team does, especially dealing with the elderly and those who are in abusive situations that are elderly, but that we don't have the same a level of expertise or the same even resources. I think, Marianne, I just want to recognize that placement issue that you raised. And so what I have been interested in understanding is if we were to expand our services so that we can support people who are severely mentally ill and who are in this very hard to serve category, because I think, Marianne, your point about people having dual diagnosis is right, maybe more than that, but at least a dual diagnosis. But do you have the tools and the skill sets on your team and resources to support that area of mentally ill, homeless people?
So that's a tough one. I'm reluctant to say, no, we don't need more resources, because we always need more resources. But I don't know that resources to us only would benefit this group, because we can serve all the referrals. So if I think perhaps the gap may be from the hospital to the discharge that aren't being referred for a conservatorship, because we do conserve all, of our 323, how many were conserved at least temporarily, Lisa? Like, nearly almost all of them. So we can serve everybody who's referred to us. So I think the gap might be from not being referred.
Yeah, that's actually a really good point. I will say that your predecessor made it very clear to the board that you had, the reason I was asking about the expertise and the expansion is that your predecessor made it very clear that you did not, that she didn't see that the role of that the conservatorship tool, she saw it as really something that was more and Marianne, she wasn't actually your representative, but a leader in the county, that there was just a discrepancy about whose responsibility dealing with this very high need population was, and whether or not it was an appropriate role for the public guardian's office. And I asked that, I'm really asking out of sheer wonder about how we weigh in on the state, if they're going to be making resources available for this community. Is that something that you all advocate for along with the county, or is it something that a different part of the organization should play a leadership role in, or should that go under your work? And I genuinely don't know. It's a real.
I think it's a combination, and I'm a little. One of the concerns I have about saying yes, we can be responsible for that group is, again, it goes back to the placement, because we can conserve a lot of people, and especially those that are dually diagnosed with substance abuse problems. Even if they're conserved and they don't have a place to go and they're back out on the streets and they're still actively using, the conservatorship doesn't do much.
Mm-hmm.
It doesn't change behavior unless there are supports. So as much as it looks like everybody on the street is conservable, what does the conservatorship look like? What are we doing for them? So it needs to be sort of a bigger picture with some executive or extensive treatment and housing and therapy, and it's got to be a large group effort.
Right.
Conservatorship alone isn't the answer.
I guess what I'm concerned about is that I don't feel like conservatorship has been hasn't been brought in enough to even the discussions that we've been having as a county on this particular issue. and I don't mean that, Marianne, toward you. I mean, like, I don't think we've done a good job of engaging your office to say, how can you play a role? And I think that may be, in fact, why there are not the number of referrals that I would actually expect, to be frank with you, given, just given my own personal
Right.
experience. So I see that. I think Curtis was with us. I wanted to see if, Curtis, I just wanted to see if you had any, your nameplate says Lisa.
I see
But,
that.
but Curtis, if there was any.
Because I got an invitation late, and Lisa sent me her invitation.
Oh, thank you, Lisa.
Sure.
Curtis, were you able to think a little bit about what I was asking? And do you want to weigh in on this discussion?
Yeah, I think what you're asking, we moved away from the questions regarding the 5270, but to try to answer a question about the grave disability and homelessness, many of the homeless population aren't considered gravely disabled because they're able to procure food, water, and regional shelter and medical care. There is a group of homeless individuals that you alluded to that are mentally ill, that somehow, despite the resources being available, aren't able to procure those basic needs. And that's the group that's eligible to first, as Marianne said, come into a hospital on a 5150. And the pathway from a 5150 to a conservatorship is exactly what she was alluding to. So they start on a 5150, they proceed to a 5250, which is a 14-day involuntary hold. Then they would proceed to a temporary conservatorship, which is a 30-day hold for grave disability. And then if the physician believes that they're going to need ongoing care, quote unquote, involuntarily, then they would proceed to the permanent conservatorship, which lasts up to 1 year. And I think part of what Marianne was alluding to is that there is a shortage of available placements. And so if we had the opposite scenario where we had a generous overabundance of placements, I would anticipate that we would have not only more conservatorships filed, but more conservatorships awarded as well.
And just for a permanent conservatorship for somebody who's gravely disabled and like significantly mentally ill, what kind of placements would they go to?
So most of them, their conservatorship will be wrapped up usually in an LPS facility like BAP. I would say most of them start off in a locked facility, something like a IMD or MHRC. And the reason being is that they have either failed to comply with all the other lower levels of care already. And that's part of the consideration the psychiatrists make when they are looking at whether to put somebody in a conservatorship or not. So I think they start off at the highest level, most of them at a locked facility. And then based on their progress, as Marianne said, they get titrated down to a lesser restrictive level of care.
What is an HARC?
So IMD actually stands for Institute of Mental Disease. It's a little bit of an antiquated, stigmatized term. The state doesn't offer that level of license anymore, although we refer to it as IMD. So the new facility that's the equivalent is called a Mental Health Rehabilitation Center, or MHRC, which essentially is the same thing as an IMD.
Got it. Thank you. Thank you. That was very helpful. And Curtis, I was just asking if anybody knew a little bit about what the governor's office was thinking about the expansion of conservatorships. And Marianne was saying she thought it may be more resources for beds, which would be amazing if that's what it was. That would be really helpful.
And that's all I know about, as much as Marianne does about it. I'm aware that it exists, but I do understand it is to help with the continuum of care as well. Not only the immediate continuum, as we talked about in some of our other subcommittees, but really with the whole continuum, because in order to drop somebody down from a full facility, they have to have an open bed to drop to, and so forth and so on.
Yeah, and I will say I reached out to the governor's office actually over the weekend because I was so interested in what they're up to. So I missed my call back. So I'll let you know as I learn more, because I want to make sure we're supporting what's going to be best for the people who live and work in our community. So I really appreciate this. And I wanted to say, I thought the report overall was very, very informative. I mean, very informative. I learned a lot, and I particularly appreciated the longer term goals being set in at the back. One request I would just want to make, and perhaps Curtis, this is of you, is as we're convening to take a look at the needs of the continuum of care, we make sure we have Marianne or Lisa in attendance, because I think a number of those meetings we didn't have you, and I would really like to include you in those. So thank you.
Thank you.
Those are all my questions. And I don't think we need an action to receive the report. So I'll just say thank you very, very much to staff. This was very informative. And Susan, just check back with you one more time. You're good?
Oh, this was really helpful. Thank you very much.
Thanks.
Thanks. I just want to say too, we are working on a CLT with the hospital and behavioral health to address some of these issues as well.
That's wonderful news. Yeah, thank you. And I'm glad you're included. I feel like you all get left out, and that's so I'm really happy to hear that.
Oh,
We're warming our way as the time goes by.
There you go.
So-
Lisa. You just get in there. Don't let anybody. All right. Thank you.
Thank you.
Next, we're going to go to our seniors agenda report. And Diana, are you the gal for us today?
I am. So good afternoon, Supervisor Chavez and Ellenberg. When the picture came up, my notes went away. Hold on just a minute. As you can tell, I need some digital training right here. Hold on. Okay. This past year was the first year of implementing our age-friendly 3-year action plan, and a pandemic was not in the plan when it was developed. So we were able to make progress by focusing on 3 of the 10 domains that we have. Out of our 44 action items, kind of covering those 10 domains of housing, transportation, social participation, civic engagement, 5 were completed. 11 have some progress toward completion, and the rest were put on hold. But I have full confidence that in our report in 2 years, we will have completed all our action items. Many of them depended on the collaboration with other departments, and everybody was focused on the pandemic. So hopefully we will be able to move ahead. All of our age-friendly cities responded to the immediate needs of older adults in the community, and all shared age-friendly highlights listed at the beginning of the annual report. And I just want to point out that the Citizen of the Year Award for the cities of Morgan Hill and Cupertino this year honored citizens for their age-friendly leadership. So all the cities were not only taking care of their older adults through, support through food and kind of checking wellness checks, but they also were able to do other creative things to move forward on their action items. The 3 areas we focused on was communication, dementia care and support, and social participation. Under communication, that covers a large umbrella, but Santa Clara County was the first to host a local summit on the California Master Plan for Aging that was brought forward in January of 2021. And this was the first master plan for aging the state has had since Gray Davis was governor. So we were all excited to work along our plan, along with the state plan. The digital inclusion for older adults work group addressed the 12,000 plus older adults who are in the digital ditch. The work group authored a white paper and presented recommendations to the Board of Supervisors for 2,000 low-income older adults to be connected with a device, and most importantly, training and tech support. Our dementia care and support works on our dementia-friendly initiative, and this year, with the leadership of an MSW intern, we were able to make presentations to almost all of the DEB staff, and we gained over 400 new dementia friends. And we also have the capability now to have virtual or in-person sessions, and not just to become a dementia friend and take that training over the internet. Social participation, I wanted to highlight that the seniors agenda was a liaison to the California Social Bridging Program. And at that program, they were looking at connecting through the registered voters list of specific counties to make contacts around sharing information on disaster preparedness. And then they also did include COVID. So in our county, in about a year's time, they made we have 1,083 registered voters over 60. And they made 11,328 contacts to share information about disaster preparedness and COVID. And these were in the languages of English, Spanish, and Tagalog. Next slide. We have most of what the seniors agenda does is through cross-agency collaboration. And so I just want to highlight two things that probably would not have happened if left to our own devices. And one is the RIDE program, Reach Your Destination Easily, the volunteer RIDE program, which was first supported by the Board of Supervisors. And it is run by the Saratoga Area Seniors Coordinating Council and West Valley Services. And with the county did apply for Measure A transportation grant to expand the RIDE program, not just into the cities in West Santa Clara County, but also into zip codes in San Jose, especially low income. And we are able to, then they were not able to have access to that grant on their own. We also are coordinating the mobility management, both of this increase of ridership that will happen through the RIDE program in San Jose, as well as with our mobility management of the senior nutrition program that has been using extra help positions since the former nonprofit went away, and we were left to continue to do mobility management. So this will be a great service and expansion. The Healthy Brain Initiative is a state grant through the Public Health Department, and we've been working with them and produced the symposium in March. And we had about 150 people attend. People were given continuing education units. And we really looked at had the speakers from the Placerville County Public Health Director and the Institute on Aging's Patrick Arbor. And this grant really focuses on the AAPI and African American ancestry, older adults in our community. So we're working along on those two collaborations. And for next steps, we are looking at in the coming year to, in the health and community services, we continue to promote the life files, the life-saving information for everyone files through emergency services and Santa Clara County Fire. And we also are working with public health on the Oral Health for Older Adults initiative. And so those are two areas that we're going to be moving forward on. Under social participation, we have West Valley College. They are the first age-friendly community college designated. They got that designation a few years ago, and they are really working with the Saratoga Senior Center and with the Seniors Agenda on how we can collaborate more on intergenerational activities, as well as resources for older adults through the community college system, hopefully for this to be a model for other community colleges. And looking at a positive aging campaign, as ageism has really shown through the pandemic in many different aspects of our community. And then on digital connection, we want to thank the Board of Supervisors for bringing the broadband and that part of the connection, but we will continue, the work group is continuing to work on the goal of getting low-income older adults connected with a device and the training to help out, as during the pandemic, the need for a digital connection was really highlighted with the increase of telehealth and also being able to stay connected with others and be in touch with the most recent information. So the seniors agenda continues to be the catalyst and the backbone organization for many programs and policies, and we look forward to our work in the community to create a more age-friendly community for all, including the quarter of our county's population. So I want to thank you for your time and support, and that's the end of the report.
Thank you very much, Diana, and to your whole crew. You are few and mighty. Super. So first, let me see if there's anybody from the public who would like to speak. I have no hands raised.
No hands raised.
Thank you, Collins. Supervisor Ellenberg?
Diana, thank you so much for that report. I'm curious to know, given the report that came before, what overlap or interactions there are between your department and the public guardian, knowing that so many of the conservatorships tend to be for older adults. And I saw your 3 priorities. I think they're terrific. What, if anything, is your department thinking about in terms of prevention and kind of earlier intervention with older adults who are struggling, ideally so that they aren't getting to the point of being solid candidates for conservatorship or public guardianship?
Well, that's a big load to try to work on at the moment. But I think what really points out and what I'm excited about is the Healthy Brain Initiative with public health is really looking at, there's more and more evidence, what can we do to make dementia maybe not inevitable, through diet, exercise, sleep. There's all these things that you should be start doing, 20 to 40 years ahead of time. And so one is to really promote those activities so people don't feel like this is, any sort of cognitive decline is inevitable. On the other hand, really what we have done more is as a community connection, and in the seniors agenda, we did show where Kaiser during the pandemic really wanted to do something, their employees, and they were able to bring a lot of supplies in the sense of clothing, cards and letters for the people who are conserved. And we were able to pass that on and work with Kaiser and their employees to kind of connect some people who want to share with those in our communities that don't have a lot of resources, which I think also the Christmas Embraces Senior, we help to do outreach for that. So people get connected. But we're always looking through the master plan for aging. How do we kind of work together on some of those things? I think will be coming up.
And thank you for that. And is there kind of a warm handoff the other way when those supposed permanent conservatorships end after just a year? I'm certain there are HIPAA concerns, but is there a mechanism to sort of reconnect people so that they'll continue to have support and aren't likely to just decompensate again?
I don't know if we are the best person to hand it off to, but it's I think what the seniors agenda does is look at with the the behavioral health, like on their mental health stakeholders advisory, as to how many programs are they having in their innovation grant that go toward older adults. So it's more there being the advocate. Are there things in place that they can be referred to, right? Are there programs in place? Or there's ways to do that? So that's more of where I would probably be working on that angle.
Sure, thanks. And it looks like Marianne wants to weigh in as well there.
I just wanted to chime in that there is a warm handoff for intensive case management and supportive housing. So there are handoffs, just not necessarily with seniors agenda.
Got it. Okay, thank you so much. I appreciate both of you.
And Susan, I really appreciate the question because I think it raises another issue, which is just that And it's actually something you've really taken a deep dive into, and something I'm very interested in. And that is, how early can we start doing prevention and intervention? And what's so great about the overall, the master plan, and then the age-friendly cities, is it really is asking all of our institutions to take a giant step back and be support and intervention as early as possible, which I'm very excited about. I think what they've done with such a small amount of money is really incredible, and in partnership with our cities. I think the other thing I just wanted to say about Supervisor Ellenberg's point that I think is very illuminating in my mind, is that just given the sheer volume I saw in your report, the number of people who are going to be considered available, like just the aging process. And I can't remember if it was Eric Crothers who did that presentation for us about 5 years ago, who said, okay, in the next 5, 10, 15 years, you're going to have so many seniors that are living that we have to have a much different approach than we have. And so, again, I really appreciate the report, because I think it puts in our minds this balance of services that we're going to have to be thinking about. So thank you.
And I just dare say this, Supervisor Chavez, because I know we're about the same age. That early intervention they're talking about, I think, is us. So I'm happy to get on that diet, sleep, whatever plan it is, so that I'm fully with it 30 years from now.
Okay, so I'll be hosting another symposium in the spring, so I'll be sure you all we can be invited to that. But I think the other thing is, not only is this a growing population of older adults that are the baby boomers, but the other fact is once the last baby boomer dies, the millennials will be turning 65, and there's more of them than there are baby boomers. So this is not something that's going away. I mean, this is
also just want to note, we can't skip from boomers to millennials. I mean, we've got a whole Gen X here. Thank you very much.
Well, and that's the poor point about Gen Xers, right? But
here we are.
But I do think, and I think it's so important for the whole intergenerational when we think about prevention too, because they said, like, it used to be like the Americans had 3 people they could go to an emergency about 20 years ago, and now it's down to like 1.5. And how many people most people are in a very generational bubble and don't have a lot of interaction with people from other generations. So it really behooves us all to and make younger and older friends. So
yeah, thank you. Thank you very much for the report and the good work. This is to receive the report, so I know no vote is necessary, but I just do want to say well done, and thank you to you and your volunteers. We're going to move on to item 6, and this is the Senior Nutrition Program Annual Report. And Diana, is that you again?
No, thankfully Vanessa came back from maternity leave. Thank heavens.
I'm back.
Welcome.
Thank you so much. Okay. Good afternoon, Chairperson Chavez and Vice Chairperson Ellenberg. Thank you so much for taking the time to take my highlights from our annual report for the fiscal year 2021. My name is Vanessa Merlano, and I'm the Senior Nutrition Program Manager. I'm officially drowning. I have a 3-year-old and a 1-year-old, so it's crazy at our place, but we're surviving. That's the good thing. On to our highlights. Next slide, please. Last year was a year filled with a lot of changes and a lot of programmatic pivots that allowed for our operations to continue. I know you all know that we are an essential service in Santa Clara County, and it has required a lot of policy and procedural changes that allow for our operations to stay open. Another first for us is that last year was the first year in the last 45 years that we did not operate the Meals on Wheels program. So I say that because the 1,199,298 meals that were provided through senior nutrition were, for the most part, through the congregate meal program, with the exception of July Meals on Wheels numbers, because in September, which is the date that we officially did not manage the Meals on Wheels program. This is a huge increase for our congregate meal program. Just last year, 20% increase from the year before, and the year before was a 20% increase from the year before that. So in the last 2 years, since the pandemic started, we've grown 40%. And at this point, I'd like to just highlight a couple of the programs that we're operating. And they're operating because, for the most part, the declaration of emergency that continues to persist. So for our dine-in cafe programs, we provided more than 904,000 meals. And these meals were and are currently being provided through to-go or drive-through modalities. We've got 2 organizations that are currently open for congregate meals where people can sit if they so choose to eat a meal, but the vast majority of our programs are still to-go and drive-through. I'd also like to highlight the shelter-in-place meals. We provided 139,418 shelter-in-place meals, and these meals are special because these are clients who are choosing to stay home because of the high risk of COVID-19 on the older adult population. These clients would traditionally not qualify for Meals on Wheels services, but again, because of the declaration of emergency, they're able to receive meals, and these are provided through the same Meals on Wheels program, so frozen meal delivery. An additional program that I'd like to highlight is the site home delivered meals. And I just want to give a big shout out to our community partners because they've really risen to the occasion and they've been able to do things that I didn't think that were possible. So along that vein, it's the site home delivered meals. These are meals that are provided through our community partners and delivered to a person's home. And just as an example, and this is just one of many, Salvation Army was delivering meals to senior housing complexes in their nearby area. And this really helped us to get people hot meals that were unable to leave their home for whatever reason. Next slide, please. We served a total of 12,702 unduplicated older adults through the program. We enrolled a lot of participants, 2,113. This is a big enrollment increase, about 50% for us. The majority of these were through online registration. So we've been continually thinking about how we can pivot to ensure that people are accessing our services more through online registrations as opposed to paper registrations for COVID precautions and whatnot. But we were able to get a lot of registrations through online, and this allowed for people to get their registration cards quicker and allow us to collect more relevant data and more accurate data that much quicker. The majority of our clients are 75 and over, and 45% of our clients live at or below the federal poverty level. And I just like to highlight that 67% of our clients are of a minority base, and that the majority within that minority are of Asian descent. We collected 3,500 surveys last year, and we had questions on our surveys related to our COVID-19 response and some other questions related to access to health services. And 63% of the clients that we serve indicated that they had adequate access to senior nutrition program services. 25% indicated that they did not have access to telehealth services. And this really is illuminated by this next survey point, in that 82% said that they did not have adequate internet access. And so we'll look continually to identify how we can partner with organizations to close this gap. But on the bright side, 98% of our clients did indicate that they were able to connect with family and friends during this time. And we know with isolation, this is such an important thing for our clients to have access to. Next slide. I'd like to end on a couple of opportunities and challenges. Diana so graciously already offered a little bit of overview on our partnership with RIDE. But again, the county co-submitted an application for Measure B funds for the expansion of RIDE into specific low-income zip codes within the San Jose area. I'm excited to say that we're currently in the process of getting a list of qualified candidates for this position, and our partners over with RIDE are involved in this process, and we're also going to be working on some of the security issues that might come about because of the fact that RIDE is a program that's operated outside of the county. And so we're just working on those couple of things, but a lot of movement thus far, and we're very excited for the expansion. And we feel like we are situated in a place that is very well, it's a well-situated partnership in that we've already got a mobility management program that provides a lot of transportation services for older adults. So we think we've got a good starting point for this RIDE expansion into San Jose. And the last thing I'm going to say is in the last year, again, it was a very difficult year. Unfortunately, Billy DeFrank, our long-standing LGBTQ+ congregate meal program, was no longer able to stay operational. And throughout the next year, we'll be identifying opportunities with our community partners to see if there's a place where we can erect a congregate meal program that does provide services for this specific community. And then last but not least, I just want to thank the senior nutrition program team, 9 staff, big programmatic overhauls, working a lot to ensure that not only we were providing services, but that our contracts stayed up to speed. We got a lot of additional federal monies. And because of that influx of federal monies trickling throughout the year, we did need to pivot a lot from a contractual standpoint. And so I just want to acknowledge the team and how well they did throughout the last year and even before that. So that's the end of the report. Welcome any questions. Thank you.
Thank you so much. I'm going to first see if we have any comments from the public.
There are no requests to speak.
Oh, thanks, Colin. And I will go right to Supervisor Ellenberg.
Thanks, Vanessa. That was a tremendous report, and you and your team have done really just remarkable, awe-inspiring work throughout the course of the pandemic. I had just 2 questions. First, was did the Billy DeFrank Center not work because they had to be closed during COVID, such that you could reinstate there when they're reopened, or is it permanently not a viable site anymore?
We have been informed by the Billy DeFrank Center that they are no longer going to be a viable site.
Okay, thanks. I'll look into that offline. And the significant, I mean, really just a huge increase in need during the pandemic. If you can speculate, how much do you think will drop back down? For example, the folks that you said that didn't need meals before COVID, but then because they were sheltering needed them. That's one group that I expect would drop off. Who else do you expect to drop off, or do you expect the numbers to hold steady at this much higher level?
I think so far as the declaration of emergency exists and that continues into next fiscal year, we do think that the numbers will stay at the current level. And I think maybe even into the future. There was a huge outpouring of information that went out into the community related to our services. And I think those clients really appreciate our services. They see the value and how it connects them to other resources in the community, and they appreciate the quality. I think, a lot of our programs, the majority of our programs are a cook on-site program. And so I think that a lot of those clients will be here to stay. Now, as it relates to the self-sheltering clients, those clients that are not traditional Meals on Wheels clients, but are currently on the program, we think that those are clients that were already existing clients on the senior nutrition program on the congregate side. And what we'll try to do is transition them back to the congregate, to the congregate setting. So I don't think that those client meals will diminish either.
Got it. And what I think I heard there, and I'll reflect it back and tell me if it's not correct, is maybe not so much that the actual need increased exponentially, but that there was far more awareness, and that you said you got the word out, that more people learned about the services and started taking advantage of it, as opposed to not needing it before COVID and needing it now.
I think it was a combination of the two.
Mm-hmm. Okay, great. Thanks again very much for the report.
Thank you, Susan.
So thank you. Just to, first of all, I want to say well done and welcome back. That's, it's amazing amount of work. And I guess what I'm very interested in is better understanding what we're learning in this new era. I think the point you raised and the point Susan raised about, who's needing meals, why, and even, I'm even intrigued that there is this overwhelming desire for seniors to congregate now that, I'll tell you, Supervisor Ellenberg, that the VASC has seen, like, I think their highest day, they were at like 400 meals, people in line for 400 meals, and 475. Thank you. And that we still have a Viet Tu Te who is providing Vietnamese, are they vegetarian or vegan? I'm not remembering.
Vegan. You're correct.
Yeah, meals still on Friday, Saturday, and Sunday, and they stay. We limit them at 200 or 250 meals. Is that right, Vanessa? 250, and they're hitting past 200, even with the Vietnamese Service Center being open, and so part of what I'm wondering about is how we're managing the fact that people are choosing with their feet where they want to be. And what I was told, and this was anecdotal, is that we had Viet Tu Te is still maintaining a relatively robust group. The VASC is hitting almost 500 a day. And yet the Seven Trees Community Center may have meals available still. And I think part of that is the customization of the meals and the vegan, and there are other issues I'm sure that are all part of that. And I'm really trying to better understand it, because I want to understand whether or not, for example, we need to expand the Viet Tu Te contract, and even as I'm looking at your numbers, what are the implications of what we're seeing? So a couple of requests that I have that I would love to get an off agenda report about how the congregate meal sites are working. How many meals are being served daily? How many, if we have leftovers, how many is that on average? And then from our congregate locations, are we turning people away? And if so, how many people? And I'm also really excited about something that may be harder to quantify, and that is, based on the location people are at, like the VASC, how many of them are signing up for other services? And I know you have folks out there doing that, but I think that's such an exciting story. And then for each of these, what are the meals being served? Because, the Seven Trees Center isn't, Vanessa, is that one that you manage also? Seven Trees? Yes. Yeah. So looking at this, I think we would learn a lot, and I think it would help us in some decision making about our future investment in senior nutrition in particular, but in generally how we're approaching food and our food systems overall. And again, I just want to say a really big thank you. I'll look forward to getting the off agenda, but you guys are doing really, as a team, amazing work with the small, the mighty, and managing a lot of different sites. So thank you for all that, and appreciate you.
Thank you,
Do
Supervisor.
you want a motion, Supervisor Chavez, for the off agenda report?
Thank you.
So moved.
Thank you. I'll second that. Colin, can you take the roll?
Vice Chairperson Ellenberg.
Yes.
And Chairperson Chavez.
Yes, thank you very much. All right, we're going to move on to item 7, and this is our cross systems team report.
Good afternoon, Chairperson Chavez and our Vice Chair, Susan Ellenberg. This is Deborah Porche Usher from SSA. It's good to see everyone. And I'm accompanied by the Director for the Department of Family and Children Services, who will also introduce themselves.
Good afternoon. Daniel Lowell, Director of the Department of Family and Children's Services. Good to see everyone.
And we have no formal report other than what was submitted, but we're both here to respond to questions that you may have.
Excellent. Let me see if there's anybody from the public. I see no one from the public. Supervisor Ellenberg.
I don't have any questions.
Thank you. Thank you very much for the written report. And I just have a couple of comments that I would like to make, and want to thank you and your staff. I know this is a lot of work that you've undertaken, and I really very much appreciate the information in the report. What I was hoping to get from you were, for the next report, very specific goals and objectives and key performance and client indicator outcome. And I would like to request that these metrics be included in the next report back, in addition to the timeline for projects, so that it's embedded in the next full report that this committee gets. What I would also like to ask is that there be an off-agenda report just outlining what those goals and objectives and key performance and client indicators will be, along with the timelines. It does, just because you're already working on this, but to get that within the next couple of months, just off-agenda would be great.
We can do that.
I appreciate it. All right. We don't have any other comments, and I think we'll do a motion just because I requested the off-agenda report. Supervisor Ellenberg.
Sure. Move the direction as provided.
Thank you. And I'll second that.
Vice Chairperson Ellenberg.
Yes.
And Chairperson Chavez.
Thank you. Yes.
Thank you.
All right. So now
thank you both for your support.
You bet. Have a good, happy New Year.
Same to you.
So we'll now go to item 8, and this is the Office of the Children and Families Policy Report.
Good afternoon, Chairperson Chavez and Vice Chair Ellenberg, Rustia Luna, Deputy County Executive. Also happy to answer any questions regarding the recruitment process for the position, the Director of the Office of Children and Families Policy, which as of January 10th has been retitled to the Chief Children's Officer. And that recruitment is underway, and lots of outreach strategies also planned for that position. But I believe John is also available to answer any questions. And so with that, happy to answer any questions.
Thank you. I want to see if there's anybody from the public who would like to speak. And I see no one.
None.
Thank you, Colin. And I'll come back to Supervisor Ellenberg. I was going to ask if you had any comments, but since I know you will. No, nothing?
Well, really, just a question about the timing, and I appreciate the change in title for the position. I'm hoping that has yielded some maybe a different category of applicants. So thank you for that. Assuming and hoping that you have at least a couple of people that are worth moving forward, what do you expect the timeline to be from here? That we are both chomping at the bit to get this office up and running.
Yeah. So the timeline that I've received from ESA is that because this position is open as continuous, which I think helps yield a larger pool of candidates, particularly for positions that are more challenging to recruit for. And so the first round will be reviewed on February 14th. And then hopefully if that particular pool yields some candidates that would be moved forward to interview, that would happen actually right on the heels of that. So probably within a week or two after that review process, hopefully so it'd be probably another month or so before we would determine if we have a candidate, and of course in reference checks, et cetera. So it could be potentially another 2 months before we would have a viable candidate from the pool that closes on the 14th. So it could be anywhere from 3 to 6 months, in actuality, if we don't have a pool.
Right.
But I know that ESA Executive Services is working really hard at posting to a variety of different places. And I'm really I'm really thinking that this is going to be the time where we actually may get a very strong candidate pool. So we hopefully the tentative hire date, if we would have a candidate in this pool, would be early part of May. Hopefully sooner, but early part of May.
What are your thoughts, Rocio, about appointing an interim chief children's officer so that we can, I understand that we want whoever the official new person is to be able to hire their team. But I'm thinking it might be helpful to even have an interim person in there so that we can start having conversations about design and work plan and moving forward.
That is definitely an option that's still on the table that we're evaluating. And there have been several candidates that we've approached. But so far, it's still just on the table, and we will continue to look at that option very seriously.
All right. Thank you for that. I certainly hope that we're on the 2-month track. And that implies that I hope that you've got some really strong candidates. Thanks again very much. I know that you're working really hard on this, Dr. Lina.
Thank you. Appreciate it.
Dr. Lina, could you talk just a little bit about where the postings are happening? You know, like the new outreach. I'd love to know more details.
Yeah, they're on the standard boards like LinkedIn and CSAC and NACO. They're also on a variety of different professional sort of distribution lists, including the California Behavioral Health Department Director Association, the California Institute of Behavioral Health, California Council of Community Behavioral Health Associations, County Welfare Directors Associations of California, Health and Human Services Careers, the National Association of County Human Services Administration. Several others are also underway, Facebook, Instagram, and also looking into the Silicon Valley for Center for Nonprofits board as well. So that's just a very short list. And I'm sure ESA is working on several others.
Rocio, here's a thought that I have, and that is, I think there would be value in asking Dr. Dewan if there's a county office of education, I don't know, like whatever their association is for county office of education directors. And it sounds like the one area we're not as deep into as we might want to look is education in general. And, you know, like you know, any associations relative to, Susan, I'm sorry, you're gonna have to help me, but like principals, and I obviously know the teachers, but it does.
Yeah, principals and superintendents. It's interesting. It's an interesting angle. Those are superintendents are folks that have significant administrative experience over complex operations. Just thinking of San Jose Unified, you know, in addition to being obviously this is true of all school districts, in addition to being educational centers, they run transportation programs and meal programs and healthcare, and that's a really interesting angle.
Oh, yeah, we will certainly look into that.
That would be great. Deborah, you wanted to chime in on this?
No, I didn't know if Rocio was reaching out to me. I thought I heard my name, so I may have mistaken it if she wanted to ask me a question. But I've always chimed. I think someone who has collective knowledge, someone who really is committed to collaboration and coordination of services, someone who is committed to children and families, and Rocio and I've had that discussion. So I think they're going along the correct track. So.
And I'm wondering too, is I'm sure this is already happening, but the CAST email list must be pretty robust in terms of getting this out to CAST.
We have sent it out in the past, but we will send it out again and encourage our community members. Also, we've been sharing it with communities because in 5 locations, we're actually working with our community partners and residents. And so we've been sharing with them as well and hoping that they share it with their networks.
That's great. Yeah. And the other thing I was thinking about relative to educators is that there's a statewide organization of all of the School Board Association. There's an African American School Board Association, and then there's the School Boards Association statewide. And then they have affinity groups like the African American School Boards Association. I think the Latino School Boards Association. So anyway, I just think those associations would be ideal. And they meet and they have great newsletters. So
We will certainly follow up on that. Thank you.
and you're going to see us every month. So just we'll see you next month.
Okay.
With our two stalkers. Okay. Thank you very much, Rocio. Good to see you. And now we're going to go to our verbal reports, and we will begin with our Chief Probation Officer, Chief Garnett. Happy New Year.
Happy New Year to you as well. Good afternoon, Supervisor Chavez, Supervisor Ellenberg. I have Deputy Chief Nick Burchard on the call because I think you probably want to know mostly about the institutions. So let's jump into that and I can answer any questions you have.
Excellent.
Good afternoon. As I reported last week, Public Safety and Justice, we've been hit pretty hard on our staffing with COVID cases. Currently, right now, we have 16 juvenile hall staff that are active, and we have 5 at the James Ranch currently active. Since Christmas, it's been quite the interesting number of cases that we've had just in this past month, more than I think we had all of last year. We had 34 in juvenile hall, and we've had 16 at the James Ranch, folks who have been COVID positive. What I will say is the interesting part this time, and lessons learned, and listening to the doctors of this county, who are by far the smartest people I think I've ever met. We've only had 2 youth during this kind of break who have been positive. And so fingers crossed, I think we're doing things right. We have the ability to do so, listen to the experts. So far, I think that that's working with this outbreak, which is so much more contagious than the last year's outbreak. So I'm still crossing my fingers. I'm hoping we get through this surge with not a whole bunch more positive staff. But we've been fortunate. Education continues, and we're still doing everything appropriate. So I'll answer any questions you have COVID related if you have them.
Great, thank you. Chief, did you want to add anything to that?
No, just a big shout out to our staff that continue to come to work every day and have for over 2 years now, going on 2 years now. It's a heavy lift and they continue to do it. But that's all. I have nothing else to add. Happy to answer questions.
Thanks. Supervisor Ellenberg, any questions?
Nick, there was a period of time where kids had to be moved from the ranch to juvenile hall. Is that still the case, or are they back at the ranch? You're on mute.
You're on mute. Oh, sorry. Jinx, you owe me a Coke.
Yeah, of course I am. They're still at juvenile hall right now. It's been 2 weeks, and I think that's probably one of the saving graces that we've had for it not spreading at the James Ranch with the kids in an open dorm setting. As you see at Elmwood, in an open dorm setting, it can just spread so quick and so fast. So reacting the way we did, bringing youth back, we've really been able to separate and keep kids separated from staff as much as possible. I meet twice a week with the doctors. At what point will we be going back to the ranch? And that is our intention, to get kids back there as soon as we possibly can.
Yeah, I hear that it's good for their physical health and not spreading COVID, but it's not good for all sorts of other reasons. Are they truly isolated? Do they have access to programs, classes, visitation?
Yes.
Families?
They're still getting education. What it is just that they're able to be in their own rooms opposed to an open dorm, but they're still able to participate in activities, and we're still doing that as well. Depends whether they're on a post-exposure unit, if they've been exposed, how much activity they get with one another. Is it the James Ranch in that setting? Absolutely not. But is it the safest setting for the kids as of today? Yes. But our intent is to get them back there certainly as soon as we can. We understand the difference between the 2 places.
Sure, of course you do. And are the kids who are testing positive, as a rule, I mean, there must be few enough that you can be pretty specific. Are they getting very sick? Or are they getting mildly sick? Have you had anybody that's needed to be transported to a hospital?
No, we've been pretty fortunate. To be young, I guess, is certainly that young. We've been fortunate, and certainly with this variant, we've only had 2 youth, one from the community right now that came in that way. A lot of them are asymptomatic. They have cold-like symptoms. We have our medical staff here. If a youth does have symptoms, our medical staff will move them to the infirmary and take care of them. And so we certainly haven't had any significant issues within a youth and their health.
And with our adult population, we've been able to release a good number of people either at the end of their sentences or free trial when we've determined that they don't need to be there. Are you able to do the same thing with the juveniles?
Yes, from the very beginning of this, the chief was working with the local law enforcement agencies and the police chiefs and working about not necessarily a criteria, but really making sure that the youth who come into custody are a public safety issue, and certainly reducing our violations of probations. Our population between both facilities is 62. This time 2 years ago, we were probably 180, 150. So we've really taken the measures necessary to make sure that only kids that create a public safety are in custody today.
Thanks so much. Thanks, Chief, as well.
Supervisor Ellenberg, if I could just add one other thing that I'm not sure everybody knows. When the youth are brought back from the ranch and housed in juvenile hall, the staff from the ranch go with them. So even though they're actually in the hall, they're still programmed very, very similarly. So what Deputy Chief Burchard was saying, they're in rooms instead of dormitories, but they're actually getting the ranch program by the ranch staff.
Oh, got it. And that's nice continuity too, to be with the same adults. Thanks, Chief.
Awesome. Thank you. Thanks all. Happy New Year. Well, now I think we're going to Bob. Welcome.
Good afternoon. I'm in the dark shadows here. Apologize for the lighting. The sun is bright there, but I am here. Just want to take a moment to talk a little bit about the budget. Obviously it came up a little bit earlier in earlier conversations, and the governor's proposed budget, I think, as most folks have seen, is very very robust in terms of the surpluses that we're seeing. And on our end, there's definitely some upsides of what we're seeing, and a few things that are kind of head scratchers in terms of the support, like growth in some of the support areas. I think that we would like to see that we're not seeing. But one of our primary funding sources is realignment. So we have 1991 realignment and 2011 realignment. The 91 alignment, the revised base for our current year that feeds into the next year's budget proposal was revised upwards by about 5%. And then still estimating next year's revenues to increase by another 2%. Similarly, in the 2011 realignment, the sales tax growth has been rebased by an additional 7.5%. And then for next year, the estimates are assuming an additional 4% on top of that. So that's good news. That will certainly help in terms of it'll cover more than just the cost of doing business increase that we see each year. But it'll also give us the opportunity to rethink about some of the opportunities that we have, where we know we have some gaps, and also just some of the cuts that we did have to take during the pandemic related cuts that we had to take. So we'll be looking hard at that. But there's definitely a little bit of good news there. There's obviously a lot of support in terms of the homelessness. I won't delve into that because it's not specifically our area, but some of the overlap in some of our programs we'll see some benefit for some increased funding for homeless programs. On the Medi-Cal side, there's a lot of expansion there, and on part that impacts us, there's about the state includes an additional $50 million in escalating cost of funding for the administration of our programs. We have struggled with the state on them supporting the administration of Medi-Cal. We have reached sort of a general person's agreement just to at least have this float with the California Consumer Price Index, and that is honored in this budget request. Still insufficient, but at least it's something as we continue to wrestle with them and work with them to get a deeper resolution on this issue. There's also an additional $73 million in funding for to basically restart redeterminations. As folks know, due to the pandemic, a lot of our case processing and redetermination of eligibility was held back. So the state is anticipating getting back at that work after the public health emergency is lifted, and has included additional funds to be able to process that work. It's good news in the sense that they're funding the workload, but it does mean that it could potentially impact the roles and shrink the roles. So we'll keep a watchful eye on that. On the IHSS side, the state is forecasting an increase of about 3% in caseload, but it's essentially held administrative funding flat. We are already underfunded in this program. We're just not I think responsive as we could be. We face challenges in just terms of our reassessments and such, and this is one of those head scratcher areas where there's money in the state and they're just not funding the basic operations, but going ahead and expanding other programs. We like to see expansion. We want to see gaps filled, but at the same time, we also want to be able to do our core business and have that funded appropriately. So there'll be some more to follow on that side. On the Calworks side, we've seen an increase of about 11% in caseload across the state this year, and they're forecasting an additional 12.6%. So there was some additional funding there. We're just not exactly sure to the extent of it. We need to sort out a few numbers in our single allocation, but we're hopeful there that at least there's some funding to support the continued growth there. Good news on the Calworks side too is a couple years back, the maximum aid payment had been increased over a span of years. And this year that was honored and included. So there'll be a 7.1% increase in the maximum aid payment that we anticipate being effective in October. As I mentioned, housing programs, housing support was funded at $285 million and increased on a one-time basis by an additional $190 million. So good news there too. CalFresh similarly saw an increase around 12%, and there's correlating increase in funding there. Again, it just takes some work with the state to see what the exact amounts are, but we're hopeful that there's additional support there for additional staffing to handle that workload. We've had lengthy conversations around CalFresh and the penetration here in the state, and part of what we had said is the complexity of the program is part of the issue. And we've been pushing hard with our County Welfare Directors Association around the simplification initiatives for CalFresh, and there are a number of those made it into the governor's budget. So we'll continue to work on that through the legislative process to hopefully see that advance and create deeper eligibility for folks on the CalFresh side of things. Child welfare has a couple key areas, where the continuum of care reform, we've been concerned about the lack of funding and support around the deep needs of kids, and there's some improvements made there, as well as the sort of the ramping up of the state putting together its plan for the Families First prevention services and associating some funding with that. So the state is still working on their plan, but there are at least 5, so we don't know exactly what we'll be working with, but at least they have some placeholder funding in place for that. So similarly, we're watching the Adult Projective Services program. There's a small amount of increased funding there to serve the expansion in the population that's expanding to the 60 and over, as well as being able to do deeper case management with complex cases and such too. So there's some funding in there to support that. So just a few quick highlights. We're happy to sit with staff and go through the budget. Included lots and lots of small little items and funding of new programs and such. We're happy to take time with staff to bring folks up to speed on that. So happy to stop there and take any questions on this or anything else that folks may have.
Susan?
Thanks so much for that, Bob. And I'm certain my staff and very likely the other offices are going to want to sit down with you to walk through all of those smaller and larger pieces that you mentioned. I just wanted to ask about Calworks. You mentioned, I think, an 11% increase in caseload. Are we seeing any significant concerns in opportunities for work? Is it harder right now to get people into jobs, or is it in fact easier? And are we looking at county positions, at expanding our workforce opportunities, and how are we addressing that need, that higher need?
Yeah, I think, I think it's, the unfortunate response is like, yeah, it is complicated. What we're seeing is a whole host of different situations that folks are coming to us with. Some of it is that sort of like interim need that folks in the past may have just, they weren't facing the challenges of taking care of kids or being impacted by having COVID and things like that. So what we're seeing is a little bit more churn also in the caseload, that numbers are going up from time to time just through folks cycling through the programs due to the increased demands and pressures I think that folks are facing. And in terms of the employment side, we are looking at the different opportunities that are out there. There's definitely the similar challenges. Everybody's sort of rethinking what they want to do and feel safe doing, and we definitely feel some of that pressure. We're also taking a hard look at the subsidized employment program too, to try to incentivize work for this population, as well as just kind of unemployed populations across the whole county. So there's definitely some opportunity there that we are looking into.
So you're hearing specifically that people are concerned about taking jobs where they might be exposed. I know there's so much need in the retail and hospitality and restaurant sectors. Are folks reluctant to take those?
Yeah, I mean, I don't want to speak absolutely, but
of course not, no.
That's what we're hearing is the same exact concerns where everybody's evaluating, what it is, that everybody's taking that pause right now to say, is this right for me? Is this the right thing for my kids at the moment? I feel I don't want to threaten their health and such by being in a high risk employment situation.
And what about the childcare aspect for the Calworks qualified folks who also have childcare subsidies? Are those even available? Are the childcare programs operating?
Yeah, they're operating, and I think we're in pretty good shape there. It's more like a situational, kind of one-off, where there's sometimes challenges that folks have. I think in the budget too, there's good news in terms of the expansion and of stage 2 and 3 services and such to help with that continuum.
Thanks so much for all of this. I really appreciate the report, Bob.
Thank you, Bob. I really appreciate the details on the budget, and I think you're right. We're going to have to lean in a little bit on those basic programs. And I know Supervisor Ellenberg plays a leadership role in CSAC, but I am wondering if our county needs to double down on some of those specific areas that you've raised. And so what I'm hopeful of is that through Danielle Christian, we can get kind of some marching orders about what we're supposed to do and what we're supposed to be asking for. So that's my only request from the role.
Yeah, we're working closely with her, and she can definitely, we can get together and share the ledge priorities and such, make sure everybody's up to speed on those.
That'd be great. And if you could tell us like kind of the top 3 or 4 so we can press on them, that'd be great. Thank you so much.
All right, thank you.
Appreciate it. Happy New Year. Okay, and Happy New Year to our final presenter today, Ignacio.
Yes, good afternoon. Thank you very much. I also have a couple of updates as part of the governor's budget. One has to do with augmented funding for the child support program at a statewide level. $20.1 million in state general fund dollars, which equates to just under $60 million statewide. That is still less than what we originally were hoping for and asking for. It does not include a cost of living adjustment for the county child support agencies in California. Our hope is that as part of the budget process, we may see some of that, especially as part of the governor's May revise. But as of now, the way the governor's budget that was released, the way it stands is that funding is not included. So even though there's additional money statewide, Santa Clara County is unfortunately not slated to receive that. We would receive any cost of living increases if those were made available as part of any May revise. So we'll continue to work with our state association, the Child Support Directors Association, and the State Department of Child Support Services in hopes that a cost of living adjustment is made available to county child support offices like ours. So that's the first update. The second update actually has to do with welfare recoupment and recoupment of formerly aided Calworks cases. So as part of what the department does is we recoup public assistance, in this case Calworks, that has been expended in the past by county, state, and by the federal government. And the recoupment would normally go to pay back, based on sharing ratios, the portion that the county, state, and federal government paid out in public assistance. As part of the governor's budget, the state of California is actually going to be passing on 100% of the state recoupment that they would normally retain to pay back public assistance and their share of that assistance that was originally expended. And instead, that money will be going directly to families. So just to give you an idea of how much that is, because it is a significant change in terms of policy and also financial impact. Currently, the State Department of Child Support Services will be seeing a revenue loss of about $52.3 million in general fund. And that is made up of the money that would normally be used to repay the state for their portion of public assistance that we collect and reimburse them for. And instead, that money will be passed on, a full pass through in the form of child support payments directly to families. Now, with that said, the county's portion, which is a 2.5% of that amount, which equates roughly to about 800,000, is still being passed on to the county, and the state will ensure that the county continues to be whole. The reason that's important is that if there was a change to that amount, it would actually leave a hole of that corresponding amount of about $800,000 for social services, because child support collects recoupment of previously expended Calworks to repay back the county for their portion that's been expended. So that there's no change to that. The change is at the state level for the amount that the state would normally retain and instead will be passing on to families. Obviously, this is part of an effort to help economically fragile families continue to remain self-sufficient and to also hopefully allow them to stay off of public assistance and be able to rely on child support going directly to families. So that's the second point I wanted to update you on. Both of those were part of the governor's budget. Of course, any changes between now and the time that the budget is finally adopted, we'll make sure to continue to report back to the committee on any updates.
Thank you. That's a very interesting policy change. That's wonderful news. Thank you. All right. With that, we have our last item is to adjourn our meeting. We will reconvene on February 24th at 2 p.m. Thank you all very, very much. Thank you, staff. Great work.
Second that. Thank you so much. Bye-bye.
Bye.
Recording stopped.